This is the PEAK presentation by Crystal Ryans. The PEAK program, developed by Dr. Mark Dixon, is a relational training program which is also evidence-based and is used to assess different skills and abilities of clients. What is PEAK? PEAK is a directly trained learning module. It's when you can work with clients on developing and increasing their responses to different stimuli. PEAK works by instructors first arranging an environment beneficial to learning, such as having them sit at a table in a chair with no distractions such as toys or other stimuli. The instructor creates a stimuli specific to the client's levels depending on their sensory, developmental, and functioning level. And then the instructor uses reinforcers that are specific to the client, such as verbal praise or different rewards. For my PEAK presentation, I worked with a 12-year-old male whom we will refer to as Jason. He is diagnosed with autism and has been at the facility for almost 1 year. He has difficulty speaking and receives speech therapy weekly, and he's also been diagnosed with a mild intellectual disability. The setting is a residential facility for developmentally disabled children, ranging generally from the ages of 9 up to 21. The clients receive individual and group therapy, and there's also a special behavior school on the grounds of the facility. And for the PEAK training, we met in the therapist's office at a table, sitting in a chair with no items on the table to distract the client, and the door of the office remained closed for confidentiality and less distraction. Methods for the PEAK relational training system. For the beginning of the PEAK training, this therapist obtained consent for treatment from the client's case manager, who approved this through DCFS. This therapist then administered the PEAK program assessment to rate the client's abilities and skills. Finally, this therapist selected 3 programs that the client does not have marked as a yes or that he tested out of. The respective areas chosen for the PEAK relational training system for Jason was 7G, copy words, 7L, simple drawing, and 10O, tact farm animals. The method used for this experimental design was a multiple baseline design, which, according to the Cooper book, is an experiment design that begins with a concurrent measurement of 2 or more behaviors on a baseline condition, followed by the application of the treatment variable to one of the behaviors, while baseline conditions remain in effect for the other behaviors. After maximum change has been noted on the first behavior, the treatment variable is applied in sequential fashion to each of the other behaviors in the design. For the 7G training program, copying words, 10 different stimuli were selected, including cat, dog, mouse, car, boot, ball, bowl, tree, home, and sky. For this training program, the therapist presented each word printed on the top of a piece of paper. She then gave Jason paper and a pencil and prompted him by saying, "Write this word." The progress for the total session was rated and tracked in a designated table. For 7L, simple drawing, there were 10 stimuli selected again, including sun, dog, house, cat, truck, cow, flower, boot, tree, and rainbow. For this training program, the therapist once again presented the client with a piece of paper and a pencil and asked him to draw this and identify the item. His progress for the entire session was rated and tracked in the designated table. For his final training program of 10O, tact farm animals, there were 7 stimuli selected, including cow, pig, chicken, horse, goat, sheep, and deer. For this training program, the therapist presented a picture of the identified animal to the client and prompted him by saying, "What is this?" The client's response was rated and tracked in the designated table. For the sessions, there were 10 sessions for each training program. The client's response was rated as follows: 0 for no response after multiple attempts and prompts, 2 for multiple prompts or reduced stimulus array eventually producing a response, 4 for 2 prompts at most produced the response with full stimulus array, 8 for 1 single prompt of either verbal or visual nature, and 10 for independently producing the response with no prompt. For each session, the client's total score for his responses was totaled together to evaluate the results. Upon emitting the correct response, the client was given 2 M&Ms. If the client did not give the correct response, he received another prompt. The results for the Peak Relational Training System of Jason. As the graph shows, the client's correct responses increased as his sessions went on. For example, for his copy words, the client really struggled at first to copy the words that he was given on the piece of paper, but as his trials went on and he had correct responses in receiving his M&Ms, the client emitted the learned response. For the farm animals, the client had the most growth in his correct responses, raising his points from around 30 to up to 60. And finally, for the simple drawing, the client had a slight increase, but his main motivating factor was getting his M&Ms, and this reinforcer brought about the positive outcome of the experiment. As the sessions went on, the use of the M&Ms as a reward were backed off, and the reward was then verbal praise, which the client responded well to. The Peak training module worked well for Jason and is going to be implemented into more of his treatment at the residential facility in order to help him gain more living skills